To hear that your child is 17 years old and using heroin, it just kind of knocks the breath out of you. We did not know what to do.
Substance use disorder is a major public health crisis.
This is 9/11 happening every 10 days.
The heroin overdose is
We have to realize and wake up to the notion that this is urgent.
The cost of addiction cascades throughout our society.
There's no other thing that I know of that touches on every facet of American life. Nothing else.
Literally, only 1 in 10 patients are able to access care.
It just really has gotten out of control.
Families are desperate.
You know, how many of our children have to die?
We were at the mercy of the business of recovery.
I don't want to say one system failed my son. All the systems failed my son.
We don't see people in these systems. We see the substance first.
And then people push the person to the curb and say, this is on you.
It is a belief that it's something that the person is doing to themselves, that they choose to take the drug.
That's totally wrong.
I don't know anyone that's struggling who doesn't want to stop.
Guys. Hey, Tanya, how are you?
How you doing? There are so many pathways to recovery, and working with individuals where they are, working with family members where they are, is the best way to start that journey.
Recovery is possible.
You can reach out and just say, I will sit with you in your darkness.
Those messages didn't exist just a handful of years ago.
It gives me so much hope that we're actually going to do something different.
People are starting to understand that this is not a moral failure.
And having and holding the dignity of a person who uses drugs.
That's a game changer for a lot of families.
We can all do our part to help save lives from the disease of addiction.
We need to be there for each other.
Well, tonight, the CDC is sounding the alarm about a record number of deaths in America from drug overdoses.
Overdose deaths in Maine continue to climb after setting a new record last year.
2021 was the deadliest year for overdoses in the U.S.
Today, in a statement, President Biden called it an epidemic of loss. 1 American is dying from a drug overdose every 5 minutes.
It is a public health crisis that's preventable.
Our children are dying, and no one's helping us.
By the time I realized what was going on, it was probably junior year. To hear that your child is 17 years old and using heroin, it just kind of knocks the breath out of you. Like, how? How could this be? I don't know anyone who used heroin my entire life. And then the whole family was, in turmoil. We were all in turmoil. I had no idea what to do. I lost my son, Rory, at 29 years old to substance use disorder after 11 years of system failures that kept him from getting well. I don't want to say one system failed my son. All the systems failed my son.
If you go back to 1980, 6,000 people were dying of overdose. In 2015, 52,000 people dying of overdose. 2021 preliminary numbers suggest 108,000 people are dying. There's over double the overdose rates of suicides, of breast cancer, of prostate cancer, of gun deaths and accidents. This is 9/11 happening every 10 days, and we're not doing something about it.
The situation has gone much worse over the past 2 decades, and that was started at the end of the 90s, beginning of the 2000s, with overprescription of pain medications that contain opioids. So by 2010, we realized that we have a serious problem in our hands.
This is what the opioid crisis looks like in West Virginia. People addicted to pain pills.
The heroin overdose for 911, 33-year-old female was unconscious, is now conscious.
Heartbroken families have told me their stories time and time again about how the opioid crisis has claimed the lives of their loved ones.
Then around 2015, we saw a dramatic increase in the overdose deaths associated with a synthetic opioid, fentanyl. This was fentanyl that's illicitly manufactured. That is 50 times more potent than heroin. And as a result of that, it's more addictive, but it's also much more lethal.
And tonight, an urgent warning from the DEA about fentanyl, laced drugs on the streets of America. There are millions of these dangerous fake pills out there, and they are killing thousands of Americans.
Fentanyl has really changed the game, both in terms of individuals who are struggling with substance use disorders, as well as young people in particular who are at a party taking a pill or a powder and they're not struggling with the substance use disorder. People don't know what they're taking. They buy a Xanax, they think it's Xanax, it's fentanyl. They buy an Adderall, it's fentanyl. They buy a Percocet, it's fentanyl.
When teenagers attempt to purchase the prescription drugs on the black market, more often than not, they are sold fentanyl colored, sized, and stamped to look identical to the prescription drug.
This is all about money. People are pressing fake pills to make money. And young people at a party, whether it's high school or college or, wherever they are, they're sitting there having a party and their friend gives them a Xanax and they take it and they die.
And this manifested for the first time during the pandemic, where we've seen a doubling of the number of teenagers that are dying from overdoses from fentanyl. And it's not because teenagers take fentanyl, they don't. It's not they take heroin. The rates of heroin use and cocaine use and methamphetamine use in teenagers is extremely low. It's very likely the fact that they are getting these illicitly manufactured prescription pills. So the problem is much more complex than at the beginning of the opioid crisis. Now, because fentanyl has contaminated most of the illicit drug markets. And as a result of that, it's diversifying the population of individuals that can die from overdoses. It's not just people that have an opioid addiction. It can be someone that is occasionally experimenting with drugs.
As fentanyl enters the equation, we have to educate everybody, right? It used to be you educated the highest risk groups. Now we have to educate everybody because one pill can kill. The other is we have to shift our model from letting people hit rock bottom. We had to shift that model before because we know family members and concerned significant others can make a difference. But right now it's death. There's no rock bottom is death. We have to stay engaged. We have to be first responders. So letting someone hit rock bottom has a new meaning with fentanyl in the equation. And we have to be proactive and act and not just let go of those who are struggling.
We as a nation aren't doing a good job in helping people understand the depth of the substance use issue and the overdose crisis that we're in and how many lives are lost. Each one of those people who have died is connected to a family, is connected to a bunch of friends, is connected to a community.
People that are dying from overdoses tend to be younger, and they may have young families. So the consequences are not just that they die, but they are leaving their children orphaned.
The number of children removed from their families because of substance abuse increased 13% in recent years, driven in part by the opioid epidemic.
We know that the cost of addiction cascades throughout our society.
There was an estimate that just from opioid use disorder, the cost to the country were close to $500 billion. It goes beyond that element of the medical consequences or the mortality. It permeates actually at the essence of a society.
Are we going to talk about all of those other connections as it relates to healthcare, education, how it impacts the family? Are you going to talk about the criminal justice system? Are we going to talk about the connection between gun violence, suicide deaths, sexual assaults, and substance use? Are we also going to talk about mental health? What else are you going to talk about as it relates to our substance use overdose crisis in the United States? Because substance use touches on everything. There's no conversation that you can have where substance use in some way is not a factor.
I absolutely did not know where to turn when Rory needed help. When he was struggling, I really had no idea where to go. There was no support for me for years, really. And, we were all just falling apart. The whole family was falling apart, and there was nothing. The very first time, he had overdosed, that we were there, the police come because it's always a crime scene. So they were going through the room and stuff, and everybody was concentrating on the drugs. We just watched our son die and come back to life, and everyone's concentrating on the drugs. And I was so mad. And I said to him, this is ridiculous that that what you're worried about is the drugs. And my son is on his way to the hospital. He was on a court program at the time, so I was like, I'm gonna have to tell his officer that, what happened, hoping that they would give him treatment. That was what I thought would happen. So I went to the hospital and I walked in, and when he opened his eyes, he just said to me, like, why couldn't you just let me go? That's how they feel, And, he was stable. We're sitting in I'm waiting for him to be let out of the hospital. Next thing I know, 2 sheriff officers come. They handcuffed him in the hospital right in front of me and took him out. And he went to jail. This is an illness. My son died. He died in front of me, and they put him in jail.
America's public enemy number 1 in the United States is drug abuse. In order to fight and defeat this enemy, it is necessary to wage a new all-out offensive.
Drugs are menacing our society. They're threatening our values and undercutting our institutions. Our spending for drug law enforcement will have more than tripled from its 1981 levels.
This is crack cocaine. Our courts, our prisons, our legal system are stretched to the breaking point. But the war on drugs will be hard won, neighborhood by neighborhood.
Prison system in the United States is the biggest treatment referral place in the United States, period, full stop, in terms of substance use and mental health. It's wild.
Substance use is the only illness that I'm aware of, really, that is criminalized. It's just the way the system is set up. The judicial system is set up to punish for a crime, and having the possession of a substance is a crime.
We know the overwhelming majority of people in the criminal justice system are there because of substances, or substances are associated with their crimes.
When I say the system is working as designed, I mean that intentionally. We could talk about what makes the substance use necessary for some folks, and then how certain people's need to cope with a system that continues to oppress them with certain substances, we make it criminalized.
Putting someone in jail or prison because they are taking drugs, first of all, is not going to do anything to stop their drug taking. In fact, the social stressors of isolation are one of the factors that make them more vulnerable when they leave jail or prison to take drugs.
My son Rory was 18 when he had his first nonviolent third-degree possession charge, and he never got out of the system. He was 29 years old when he passed away. After his entire adult life, he was in the judicial system for, just for substance use. In New Jersey, we have a robust drug court system. So when he was arrested, they said you have an option of you can either do your prison time or you can go into drug court.
It's often at the discretion of the county who is put into drug court and who is not. Now, there's standards, but they're not always followed.
Recovery court or drug court in and of itself is a blunt tool, and it's a one-size-fits-all for everybody. And it depends, like everything else, it depends on the parole officer you get, the judge's mood that day. So it's sad that it's so variable in terms of outcomes.
The idea behind drug court is that it is a diversion program, and what they're trying to do is promote recovery, right, and keep you out of prison. So it sounds like a great system, and it could be, but somehow we got lost in this system where there's just so much punishment.
People can then use the threat of jail looming over their heads, but if being punitive worked, we would have empty prisons and there would be no need for recovery court.
It just doesn't make sense for a medical issue. We would not do this with any other illness. The definition of substance use disorder is the inability to get well despite negative consequences. And yet, the whole system is set up as negative consequences.
We know that drug addiction is so insidious and that people will relapse. And unfortunately, what we're doing is when someone relapses, we're putting them in jail rather than putting to a higher level of care of treatment.
If you're in a court program and you're testing positive for a substance, knowing that you already have a charge, you've just committed a crime. You may not have it in your possession, but a positive drug test says you used it. And that punishment is jail time.
Drug court, in its name, is a failure. We don't see people in these systems. We see the substance first, and we see the problem that they, quote unquote, created.
Fan him out, or
I made him do drug court. His entire adult life, he had no say in anything. His life was totally controlled for 11 years for a possession charge. It's heartbreaking. And he's not alone. It's so many people. So many stories exactly the same.
Oh, who's the favorite uncle now?
The only way, truly, that this could change and we could treat substance use like we do every other medical issue is if we decriminalize the substances.
Like, if it's really a disease, treat it as such. Let's put in a medical solution, not a criminal justice solution. Let's not have the biggest referral for treatment be the prison system.
And certainly, criminalizing substance use disorder also facilitated structural racism because many more individuals who were Black have been incarcerated in the United States for substance use disorder, many more than white.
The war on drugs and drug policy has mainly been to keep people who are marginalized more marginalized. The system is still set up to arrest people of color and make it a criminal justice issue rather than a treatment issue.
Let's be honest, we probably wouldn't be having this conversation if white folks weren't dying of opioid overdoses and the numbers in which they were dying in the late 2010s. And one of the things that comes up for me is just like, had we had a culture where white mothers who lost their children were able to talk to Black mothers and women of color about the traumas of substance use and that pain, we'd have a totally different culture because there's so much wisdom of surviving from Black women and keeping families together when a loved one was incarcerated because of the war on drugs, or they lost a loved one because of the war on drugs. We'd have a totally different world. We'd have a totally different conversation about the current opioid epidemic.
We need to do better to work for inclusivity as it pertains to recovery. So we have to learn how to work together better to message it better that recovery is for all.
Mm-hmm. I agree. And at this point, I don't know anybody it hasn't affected in some way, shape, or form. Substance use disorder is in every neighborhood. It's every class, socioeconomic status, none of that matters. But unfortunately, people of color are less likely to seek help because the truth is that the exposure to the system before the age of 18 is way more likely for a person of color than it is someone else. And so there's an automatic removal of trust, which is a huge barrier to treatment.
Any way we can get an outreach, whether it be through radio, through media, to get individuals, specifically those who are disadvantaged and maybe individuals of color, access to recovery support services, access to peer services, all of those things, divide and conquer. How are we going to do it together? Where we organize our efforts, how do we organize them, and what do we need to push the movement forward? Recovery is possible, and that's what we need to continue to message.
That equity to access, I meet a lot of women that say, look, I just can't leave my family right now. I'm the backbone of my family, especially for Black women. And we have so many stressors carrying so much weight on our shoulders. It's one of those things where you feel like you're standing on the mountaintop screaming, like, we need help, we need help.
Well, absolutely. So that goes back to education, advocacy, access, and action. And especially as it pertains to parents, where's my child going to go when I access treatment?
Correct.
What is that going to look like for the next 30 days, for the next 6 months? What is the unification process going to be with that? So when you think about families who have an interest, specifically moms or dads who want to go into treatment, it's always the barrier. Either they want to go in as couples and they're separated, which creates a divide, or where will my child go while into treatment? So we need to create inclusive spaces to support families, no matter what it looks like, for those entering treatment. all of these great things that you guys are doing, that you are doing, that people are doing in Frederick County, those options wasn't available to young families years ago. You know, so I'm hoping that we come to a place where we don't have to have these discussions about where the barriers are. I want to talk about all the strengths. My mother is celebrating 16 years in recovery, and I'm telling you, if these options were available to her, perhaps I can tell you that she celebrated 30 years of recovery. You know, but today I can tell you 16, and I'm proud of every last one, because every day that she recovers, we recover.
Beautifully said, T. I've been there. I was a very good student, I went to private school and graduated, went to college. Unfortunately, I had a foot surgery in college. I went to a doctor that I trusted, and I was prescribed opioids at the age of 19 in large quantities, and I very quickly became addicted. Once I became addicted to the opioids, my life just spiraled out of control. It changed my life. And thankfully, it didn't take my life. You've been good today. On March 28th, I celebrated 16 years of sobriety, which I'm absolutely grateful for. And I credit my son, because if I had not given birth to him, I don't know where I would be. I would not be where I am today. I know that I struggled when I got into sobriety and my son was 10 months old. There were virtually no places for mothers and children, and there still aren't. And so just working in the field and doing some clinical work, I really, really wanted to create a house that was like a home-like environment and atmosphere for mothers and children.
Oh my goodness, I gotta show you this picture of Toby. He's in his little baby room. I think AJ's excited to have treatment in the house. Teamwork makes the dream work in here for sure. Yeah. Amelia, did you have any other kids?
Yeah, I have a 5-year-old daughter. She'll be 6 at the end of the month. She lives with my parents right now, but she comes to visit about every weekend, and then I go to my parents' house and visit once a week. It's nice. She's excited to have a baby brother. So she's a good little helper.
This is a very, very tricky stage of recovery. Just coming out of treatment centers and being a new mom, the ladies are experiencing a wide range of emotions, and it is vital that we put all hands on deck and we use as many resources as we can to try to stabilize the mother and get her child adapted. Sometimes they come in, they may have CPS cases, and so we're working extra hard to encourage them, because if we can get them past that first 90 days, they typically will do pretty well to be reunified with their children. So how'd it go with the probation officer yesterday?
It went good.
I was kind of excited when they transferred your case to her. She's good.
Yeah.
It is unheard of to have a mother only have one service or agency to report to, meaning they have probation or parole, aftercare treatment, CPS.
I mean, I do worry about how I'm gonna really move forward, because I don't know which step to take.
So it's like that glaring issue we keep having coming up. I call it the hamster wheel, Yeah. You have to have vouchers to work, and you got to work to be able to afford childcare, because I can imagine that's a stressor.
Yeah.
Big time.
We expect single moms to figure it out, caring for 2 people to move through treatment and then to find that necessary support. Like, how do they get a job? How do they pay rent? The cost of childcare alone is ridiculous. And I'm coming out of a crisis situation in terms of my own health care. Who's there to support me?
I used to always get really overwhelmed, and then whenever I do that to myself, usually ends up in me relapsing. So I don't want to let people down. I don't want to let myself down. I've been there and done that way too many times, so. Okay.
It is very, very difficult to convince a mother with a substance use disorder to not become hopeless. We try to give them coping skills. Coping skills are huge for recovery. We add parenting classes to help them with their challenges and with their difficulties.
The parents we are today is because all the trials that we've been through in our life. Can anybody else speak to that? About how your children are a big part of your story and what that felt like when that story was sort of taken away?
I can. Back in November, my kids got taken, and I was angry about it. Like, my 2 younger ones, they're little right now, but my 5-year-old's like really wanting to be with me, and she's having a really hard time being away from me.
Child Protective Services is supposed to be a supportive service, and unfortunately, it has become viewed as a punishment. One of the hardest things is when a mom is doing well and she still is not able to gain what she thinks is fair access to her child. It feels punitive because it's almost like I'm just viewed as a number to the state. They don't feel as if their life is valued.
When you go to rehab, did you feel like right when you finish, your baby, like you should have had Tegan?
Yeah, I thought I was getting her back, and then they didn't hand her over.
What did you feel?
It made
right
it worse. I was disappointed in myself. And I felt like it was all for nothing for me to go to rehab.
So having your baby taken away did motivate you, right, to want to go to rehab?
Yeah.
But then going through rehab, like you're on this emotional roller coaster of when you came out.
I was so happy to get her back. And then it made it worse because I didn't get her back.
We see a lot of moms become frustrated and you just see them start giving up.
Everybody needs somebody to lean on. Our kids are going to need somebody to lean on, whether it be a coach, whether it be a mentor, whether it be an auntie, whether it be one of you guys. Like, we all need that support. And don't be afraid to ask for it. And don't be afraid to create it for your kids.
As long as we're not providing effective treatment and services for individuals with substance use disorders, people will continue to die. It's heartbreaking because you're doing everything in your power to convince them it's gonna be okay. But in the back of our minds, we're kind of wondering, how are we gonna fix this? How are we gonna step in and help?
My daughter was given an opioid prescription for surgery that she had, and she was in a lot of pain. You know, I didn't know that I shouldn't refill the prescription, and I refilled that prescription 3 times. The doctor said it was fine. I think a lot of people just didn't know what we know now. My daughter had underlying pain, and she took a pain pill, and that made her feel better. That was just the start of a 17-year journey to try to help her find other ways to soothe her pain. I did what I thought, any intelligent parent should do, and I did a lot of research, what I could find at the time. And I decided just to nip this whole thing right in the bud, and I sent my daughter to a therapeutic boarding school. She suffered traumas, and she did not get the professional help that she needed. Unfortunately, that therapeutic boarding school is closed down due to some really bad stuff. The troubled teen industry is real.
The Committee on Education and Labor will come to order for the purposes of conducting this hearing on child abuse, deceptive marketing by residential programs for teens. Untrained, uncaring staff, reckless management, irresponsible operating practices permitted these horrible tragedies to occur.
We found torture and abuse of youth across the United States.
I was stripped, my clothes were taken and thrown away.
We were all labeled liars and manipulators upon arrival.
I got 1 phone call home a week, nothing more, no access to CPS. Kids as young as 12 being taken out of school to carry out pointless manual labor.
Slowing down from exhaustion only resulted in more exercise.
A 16-year-old boy having trouble breathing. One staff told the boy that he deserved an Academy Award for faking it. He died later that day.
An admitted sex addict was one of the high-up faculty and counselors, as well as a dorm monitor living above the boys' dorm.
Intensive group sessions sometimes lasted all night. Hours would be spent with girls reliving their traumatic experiences at the unqualified hands of the staff.
Rating kids with high levels of verbal abuse, often of a highly derogatory and sexual nature. Kids were forced to eat food they were allergic to.
Human restraint also played a key role in several cases.
Staff punching students in the face while restraining.
The behavioral interventions you have heard described have no role in the appropriate treatment of mental or substance abuse disorders. As you're hearing, this is trauma-inducing and not trauma treatment.
You know, I thought after being gone for a year, she would come home and be better and get on with her life, but that is not what happened. She got worse, and we just began the spiral of drinking and doing drugs. And I began the spiral of trying to figure out how to save her. And for me, what that looked like, the only thing I knew to do was to put her into rehabs. And I put my daughter into 20 rehabs. In and out, in and out. It was there I thought she was safe.
Families are desperate. I will do anything. Someone come and save my child. Fix it, please. And in this industry, there's people saying, I'm gonna fix this. I'm gonna fix this.
The rehab business is bazillions of dollars. It is a for-profit industry. It's unfortunate, but there are people that are marketers, body brokers. They get paid to take a person and put them into a rehab. And they get paid a lot of money.
It's been dubbed the Florida Shuffle. Drug addicts from across the country have been lured to the Sunshine State for decades with the promise of treatment.
It's a process that's known as body brokering.
Many have overdosed and even died in the process of being brokered to California.
15 arrests and more than 200 charges from the Treasure Coast to the Palm Beaches.
Well, according to State Attorney Dave Ehrenberg, there were 10 South Florida treatment centers from Fort Pierce to Miami that were taking part in this patient brokering and conspiracy.
And everyone's making money on the backs of individuals with substance use disorder.
As Florida tightens its regulations, California is becoming the Wild West of rehab.
Some treatment centers are regulated and some treatment centers are not. So if it's a state-funded or federally funded program, there's rules, there's audits, they have to follow certain guidelines, and there's some regulation. The problem is the majority of other types of programs are private practice models or wellness models, and they don't have to be regulated by the state.
And some of these are the most expensive. So people with all this money who could afford to spend $50,000, $100,000 to send my loved one will often find that that loved one doesn't get the care that they need.
We've got venture capitalists who can go in, create treatment programs and invest, and they know that they've got a vulnerable population, especially young people, and that's cash in hand, especially if their kids are in crisis.
And remember that the treatment centers, if they're reaching out to you and you're Googling them, they're popping up, they want your money. They might want to help your loved one too, but they want your money.
It is heartbreaking and frustrating and maddening what parents have to go through to try to help their kids that struggle with drug use or alcohol.
When we were looking at treatment for our youngest child, Logan, at the age of 22, it was during a time where we're really vulnerable because we're feeling desperately that we need help. I would say that we were at the mercy of the business of recovery. Plain and simple. Doctors didn't have any recommendations. They didn't know. We, like other people, went on the internet and were searching, and whatever rose to the top and whatever their marketing tools were, we thought that we had located a treatment program that would support his depression and his anxiety and also his use. But at the time, they were not truthful in what they were offering, and that's such a shame. There were no regulations, there were no standards in place. Get them in, get them detoxed, transfer them to a treatment center, put in your time, see if the insurance will cover it, and when the insurance doesn't cover it, bye. Have a nice life.
I have heard from family members who have literally mortgaged their homes, who have given up everything cashed in everything they had to save their loved ones, and their loved ones died.
There's no patient or individual-centered care. When Logan was in treatment, he was given medication and he started having tremors. So someone from the treatment center contacted us, and then we were able to talk to him too, and he was really disturbed by these tremors. They really didn't have mental health professionals there. We thought they did. So it was our understanding that a doctor was on the way, but when there wasn't a doctor to help him through this, he walked himself to a hospital, to an emergency room, and they took care of it, gave him medication. Well, that was against the treatment center rules, so they kicked him out on the street. We did not know where our child was. After that hospital episode, there were no calls from the treatment center, and it just went from bad to worse.
There's just so many things that are tied into this broken system that don't allow people to get better, even when they're super motivated to get better. It's frustrating.
I have been angry at the system. I have been angry at the business of recovery. It's a money-making proposition, and it has been. They were all filling needs for us. People at their weakest moments, families in desperation, and they took advantage of that.
There are some wonderful places who are for-profit places that do a great job. But unfortunately, we do a lot of things first before you do the right thing.
We build in this country a treatment structure that is distinct from the healthcare system. And these specialized treatment programs are reimbursed without necessarily showing evidence of positive outcomes. And so you see a diversity of programs that exist all over the country that claim they can treat or sometimes even cure addiction, but we haven't mandated the system to ensure that what they say is factual.
Not everybody needs the same thing, and that's a part of equity. People need different things and different types of care in order to move towards health and wellness. That's the first thing. And oftentimes people confuse treatment and recovery. A lot of places have recovery in their name, but they're really referring to treatment. Going into treatment is you're dealing with an acute medical situation, whereas you need to be separated and monitored to help your body and brain heal. That's part of treatment. And obviously recovery is something that the person engages in on their own. It's part of their process.
I think the longer someone can stay in a protected space where they can really work on themselves, start that emotion regulation before they go into recovery aftercare, for example, is a great opportunity.
I would love to see there be more time approved by insurance companies so that we give individuals a fighting chance, because it's become like a revolving door. It's just not enough.
I have just boxes of pictures, all organized. This one is for Josh, and wonderful memories. The J Bros and Little Bro. And Logan's first Christmas. Josh was 10 years old. Jared was 8. Haley was 2. We had quite a house full. And then he was a thespian. This is a freshman year in Brigadoon. Here he is in Music Man. In 2008, we lost our oldest son, Josh, to a substance-related death. It's the love that goes on. Through photos, through memories, it's what we have, and I feel really blessed to have those. Josh was very playful. He was very childlike. He grew into a very sensitive person. And when I look at our home movies, we're always taken by how he's always there with the little ones. And he wanted to be a good example for his little brother. He wrote that in his journal. They were 10 years apart. And more of the pictures we see there together, the two of them, he really took that on. His responsibility for the little guy, and that's heartbreaking. This here is a Mother's Day card that he sent me 3 weeks before he died. And he says, Mom, I couldn't possibly ever thank you enough for all that you've done and continue to do for me. I know that I will always be a handful and a half, not true, but I want you to know that I am most grateful for having such an amazing mom. You're truly all that a son could ask for. Thank you for caring and continuing to push me. I love you, Josh. When he was in college, he said one time, Mom, and just through a river of tears, he said, Mom, I'm addicted to Oxycontin. And he said, it's heroin in a pill, Mom. It's heroin in a pill. I really was clueless. And I remember after his first time in treatment, he really, he was drinking alcohol day and night. He knew and we knew that he really needed to go back into treatment. So he was in treatment for 3 months. After treatment, he was doing well, but for one night and using one more time. I spoke to Josh 3 times that day. And then in the evening, he said, Mom, leave the latch off. When I get here, it's gonna be really late and I don't wanna wake you up. And then he didn't make it. And when the officer came to our home, I went outside and there was a chaplain with him and I just said, don't. I already know he's been trying to tell me all day that it was just too hard. And he used that one time and that was it. That's the danger, you know, when people are in treatment and they're really working their recovery, oftentimes they use one time and that's it. And that's what happened to both of the boys. Everybody was really, really worried about Logan after Josh died. And losing him was really traumatic for Logan because he was the last child left home. He was in high school when he lost him. He said, I'm not equipped for this. And I think maybe he wasn't. You know, I just think that he was so tied to his brother. And that's certainly the reason why he self-medicated. He had no other reason to self-medicate. And so for 6 years, he did self-medicate, first with marijuana, and then it turns out that a woman was selling him Dilaudid. It was prescribed for her, and she was supplementing her Social Security by selling it to him. His use increased. It got too big for him to manage. So at that point, he went back into treatment for 4 months. He was a homebody. That's why I respect him so much for going away for 4 months, because that must have been just excruciating and he must have thought that we wanted that, and that's why he did it. Like this, oh my gosh, that picture. He was a beautiful boy. When Logan came home, he was really trying to work, recovery, and he was going to meetings. He had gone back to college, and he was fortunate enough to get 2 classes that he loved, history and psychology, and he was really loving those. This is one of the last pictures we have of Logan. Missing Josh, of course, but with Jared and Haley. He was doing pretty good there. I think in hindsight, it was too soon for him to have all that pressure. Logan, he was my precious pup. I miss his laugh, he had a fabulous laugh. He gave the best hugs. He died in our home from a fentanyl patch, and around him are all of his books and his papers and a bowl of cereal, and he was gone. About 5 days before he died, he got me up out of a deep sleep to come out here and to hold him. He's 22 years old, to hold him and put a cold rag on his head because he had a fever. The night that he died and the trauma that he was feeling by having to acknowledge his limitations right then and that it was just a little too hard. Why couldn't he have woken me up and said, Mom, can't we just watch some funny movies? Dad, can't we go fishing? You know, could we have done anything to help him get through that night? Because he was really trying. Even when you have honest communication with your loved one, they sometimes are only hearing that record playing over and over in their head about what their impediments are, and feeling less than. When someone is using, they're using for a reason. So I think we have to move to a place where we ask them, what can we do for you? Make that be the message that they hear. Because some things they hold so tightly that they just can't share, and sometimes it's too late. Oh, you go to sleep just praying that they're gonna meet them in your dreams every night. It's like, maybe tonight. But it doesn't happen that way.
Alcoholism has too long been a taboo subject. We're trying to teach people the truth, that alcoholism is a disease, and that because it is a disease, it should have no stigma attached to it. Alcoholics should be dealt with like other sick persons, in hospitals and clinics, not in jails.
Substance use disorder nothing's new about it. It's happened for years. It's very frustrating that we're not dealing with addiction as an illness and really as a public health threat. There's around 20 million adults, people greater than 12 years of age actually, that have a substance use disorder. And we know that literally only 1 in 10 patients are able to access care. That's insanity. Stigma is one of the #1 things that is preventing us from getting people in treatment. Dealing with stigma is not easy. We have to do that from the kind of ground up with individuals in the community and even in the healthcare profession. I don't go around asking anybody, how do you feel about giving a tetanus shot to someone who's had an injury? Now, I have to tell you, in my 30+ years of practice, I have never seen a case of tetanus in my life. Most doctors have never seen a case of tetanus, but there will never be a patient that leaves our emergency department that's not asked about tetanus and doesn't get a tetanus booster if they need one. Doesn't happen. Yet I see opiate use disorder and substance use disorder multiple times an hour in my emergency department, and people ignore it. For example, for those individuals who present to an emergency department that have an acute heart attack, I'm very regulated. I have a certain amount of time, 5 minutes to get an EKG done. I have 30 minutes totally to get them to the catheterization lab. 30 minutes I have to get up to those doctors who are going to put a balloon in someone's leg or arm, get to the vessel and open it up. I'm very regulated. CMS had very specific criteria that we needed to follow. Charts were reviewed every single month. I may, as an emergency physician on every shift, see 0 to 1 of these. On the other hand, I can see in an hour more people that have a substance use disorder. Every single shift I'm there. And yet I'm not regulated. CMS has no real teeth in terms of making sure that hospitals are held accountable for identifying and treating, initiating treatment or offering treatment and harm reduction pathways. There is no one looking at my charts to make sure that that is done. There's no teeth in it for hospitals.
Our kids don't want to go to hospitals. They feel shamed and they feel judged. My daughter has overdosed. It's a very scary thing. Sitting in the waiting room, not knowing what was going on, only to have the doctor come out to tell us he was discharging her. And did we know that our daughter was an addict? And we should probably, get some help. Thanks, Doc.
There should be a system of care coordination where doctors understand and empathize and ask the questions, and then systems are allowed to refer people to the proper care. We need a comprehensive approach to medical care and mental health and addiction care.
Most people are co-occurring, so they have both a substance use and a mental health disorder. It is not an easy life. It is not a party, I can tell you that. Too much stuff in here. So many inventions. He was always so excited about everything he was building. We just don't know what they were. When my son first started struggling, he was early in high school, maybe even before, really. And the struggle was ADHD. Then it came out also that he had bipolar disorder. By the time we realized what was going on, he was already self-medicating. He found what worked, and it worked fast. It was so difficult to work with him at that point.
Did he have a lot of ideas all the time?
All the time. You know, that was part of his brain racing, you know, where he couldn't sleep, and so he was coming up with these ideas. There's always going to be some invention that was going to revolutionize the fishing industry. This was piece of he was making some kind of beat business, the PVC. He had PVC everywhere. He actually went to the local store and bought every piece of PVC they had. I don't know what. And then we couldn't fit it in the car, so he had to cut all of it to get it in the car. Roy loved fishing, and all he wanted to do was go work on the fishing boats because he was a commercial fisherman. That's all he wanted to do. That's all he ever wanted to do. When I brought him to the boat, I could feel it. He was peaceful, but it was hard off the boat. We would find pieces of things everywhere. We'd find some wheels. Could be for something eventually. You know, this is what he loved doing, and he would spend nights down here, and we would see him coming back with his headlamp on, coming back in the middle of the night. The boombox that, it was probably good at one time, not anymore. He needed something out of the middle of it, who knows? Oh, he's too much. He was too much. We're so used to saying that, you know, these individuals who are using substances are manipulators or liars, and so we don't listen. But if we actually listened, they give us all the clues. You know, they tell us everything that we need to know to try to get them some help. If we could prescribe him something that mimicked what he was using, maybe he could have managed things. But we don't give people that opportunity. We want to control, you know, what's going on with them, but you know, mental health is hard to control. It takes a long time to get someone stable. Well, listen, you can use a substance and get you stable like that. Yeah, it is a mess. Hard to get rid of though, you know. I mean, eventually, obviously we have to, but everyone's afraid to touch it. You know, nobody wants to touch it. So here it sits for 10 months. So, yeah, a lot of stuff.
We are very lucky that we have medications for opioid use disorder. We have methadone, which is the longest existing medication. We have buprenorphine, and then we have naltrexone. These three medications are quite effective in preventing opioid relapse and in preventing overdose deaths. They are very effective, but they are given to only a very small percentage of people that could benefit from them.
Looking back, I came to realize that my daughter chronically returned to substance use every time, without fail. Even though I was dealing with these rehabs, and I was fortunate enough with my insurance to be able to put her in really the best of the best, none of these professionals, and I mean psychiatrists, addiction doctors, people with like all kinds of letters after their names, not one of them suggested that my daughter get medications for her opioid use disorder, not one. And that's what she needed. That's what she's doing now. And that works. It's the gold standard for opioid use disorder. Yet it's 20 rehabs. None of them mentioned it.
Just like we have stigma against substance use disorder, we have stigma against the medications that we use for the treatment of opioid use disorder.
There are no other medications that we've carved out to be so difficult for doctors to prescribe. Someone with an opiate addiction needs to be on medications. To me, it would be malpractice not to at least try that for a while. It's what we consider evidence-based care. Yet there are all these limitations currently about what I can prescribe and how many patients I can have.
When she told me that she wanted to try methadone, I talked her out of it because I was told that methadone is just trading one drug for another. Now, my daughter's been on methadone for 5 years. When I read those comments on those Facebook groups, I say, well, if it's trading one drug for another, my daughter no longer lies, steals, cheats, shoplifts, right? She no longer does any of those things. So if that's trading one drug for another, I'll take the trade.
These drugs have different properties even though they are all opioid drugs. So when you take heroin, many heroin users inject. That leads to extremely fast delivery of the drug into the brain. It's activation, and then it starts to come out. And when the person starts to feel that withdrawal, they get another hit. So they go up and down, up and down. Buprenorphine is a partial agonist. No matter what doses you're taking, it will never reach the same intensity. Methadone is what we call an agonist. It can stimulate just like heroin. But the difference is that when you do methadone, you take it orally, which leads to a very slow and progressive and stable level of the drug in the brain that actually avoids these ups and downs. And it does not lead to this very fast uptake that is so reinforcing, rewarding, and addictive. And so you are providing it in a way that is safe. And it stabilizes the system. So it prevents the withdrawal, but it doesn't produce that high that individuals get with heroin that perpetuates and strengthens the addictive state.
You can't just go to your doctor to get methadone. You have to go to a clinic every single day. That's crazy.
I'm so sick of these barriers. We are, as physicians, able to give out unlimited amounts of oxycodone. I can write as much as I want, do as many patients as I want at any time. Yet, methadone is highly regulated. I am not allowed, as a physician outside of an opiate treatment program, to prescribe methadone. If you are in front of me and you're withdrawing and I want to give you a dose, I can do that. I cannot send you home with the prescription.
They just don't make things easy. In our case, it took us probably an hour one way to take our daughter to get the medication that she needed to save her life. 1 hour, one way. Now you tell me that that makes any kind of sense. It's a daily medication. We had to go every day. And if you live like we do in a rural area, you have to travel. What if you don't have transportation or gas? I mean, what if you can't afford the gas? Oh, it's just so wrong.
So making sure that physicians can prescribe buprenorphine in particular, we can avoid that and people can recover in their daily lives. They can go to meetings, they can do all these wonderful things without having to travel an hour to get care.
So many barriers to keeping someone alive. Does anybody realize how ridiculous this sounds? Does anyone get this? In the clinics, you have to go to counseling, and that's part of that's part of the program. And if you miss a counseling appointment, they punish you. Let's say that you earned take-homes, so that you don't have to go every day. Well, they'll take some of your take-homes away because you missed a counseling appointment. I mean, it's like punishment-based. Addiction is in the DSM. It's a mental health medical issue, and it should be dealt with that way, right? Just like being a diabetic. Are they a bad person? How many of our children have to die?
When we look at society and how we view addiction, unfortunately, we view it through our own lenses. So if you've tried a substance and could stop like that, it's too hard to understand why someone else can't do it.
We say in the Black community, why can't you get your life right? Why is this a thing for you? It was never a thing for me. We are a culture in America that prizes the individual. Like, you can't pull yourself up by your bootstraps. This is something that you've done to yourself. You deserve this.
What science has shown us is that the individual, when they become addicted, the brain circuits that enable you to self-regulate, to make the decision, I'm not going to do that, are not functioning properly, even though they're very, very aware that taking the drug can have catastrophic consequences. They just cannot stop it. And this is at the essence of a lot of the stigma that people have and the difficulty that they have in understanding addiction as a disorder as opposed to a choice behavior.
Addiction is such a isolating and stigmatizing situation that families are really sequestered behind closed doors. And I think, parents are just so worried about, what are people going to think about, how I raise my kid? It's just so sad because you think about, with any other disease, like if my child was diagnosed with cancer, is that how I would be feeling? No. I would have like neighbors and family and everyone checking on me all of the time, making sure that we were surrounded with love, bringing us, dinners and, just constantly being in touch. Not so much when your child is suffering from addiction.
I'm not embarrassed, or I don't want to hide the illness that my son had. I don't want to hide it. I realize we should be talking about this. So I'm really advocating for meeting people where they are and getting them the services they need. I think for families, that's a really difficult thing. It's not where you want your child to be, but it's where they are sometimes. And so it's really important to keep them safe. A couple of Rory's friends that are fishermen, who he cared a lot about, still struggle. And I keep in touch with them because I'm just hopeful that I'm gonna get them at a moment when they're ready. I'll send them a message and say, I'm just waiting for you. I'm not walking away, I'm waiting for you. The fishing industry in general has always had issues with substance use because people self-medicate. There's a lot of physical pain, which is a lot of reason where, they also use substances, is because they're trying to cope with pain. That's how you're staying awake at night. That's how you're going to bed, too. Just because you can't wind down. You don't want an overdose on your boat, and especially when you're out in the middle of the ocean somewhere. I think we have to start looking at this as harm reduction, right? Because once someone's gone, they're gone. It's too late.
Harm reduction at its simplest core is knowing the dignity and having and holding the dignity of a person who uses drugs and respecting where they're at and helping them to move along in their process how they want to move along in their process. That's harm reduction.
It's not saying you need to be abstinent. It's saying, what are your goals? What are your goals right now? And if your goal is to get high every day, I'm gonna work with you while you're getting high every day, and I'm gonna make sure that you don't die as you're doing that. So it's really just an empathetic system of care that focuses on meeting people where they are.
It took me a while to understand this one really little simple thing. There was nothing I could do to stop my daughter from doing drugs. Nothing. How I found harm reduction was in my search for what can I do to make sure she doesn't die in the meantime.
It's been a while since I've been around the boats. Last time I was there was probably before he left for New Bedford. So that was probably June, so it's been a while. There's some peace being there for me a little bit, because I know that was his peaceful place, but also, missing him. You don't fish unless you have a passion for this, because it's hard work. So to see everyone that's got the same passion as him, that's bittersweet. Our hope is that we can start opening up the fishing community to this idea that we have resources for them and we'll meet their needs. So we came up with this idea called Dock Mates. We're just starting to do the first dock walks, and the dock walks are peers in the community that are in recovery, just giving a flyer out to the fishing community. As the boats come in, they'll just give them a flyer. But it's not all about substance use, because that's not the whole issue. It's about the mental health, the physical health care, treatment on demand.
How are you?
I'm good. Good to
Long
see
time
you.
no see.
I know.
Captain Bill, how are you again, sir?
Okay.
Carla. Nice to meet you.
I got to know Captain Bill Miller through his son, who's in recovery.
This is a program for, fishermen for health care, if they need insurance. We're gonna be coming by once a week, and walking the docks and making sure that, all the crews know about it. And then also addiction recovery. We're gonna give you some Narcan, so make sure you get Narcan for the next trip.
Yes, okay, yep.
He's a good role model. He has been an advocate for Narcan because he knows what happens.
2 of them.
And that's 4 doses, 2 in each one.
Substance abuse has been going on since I started fishing. It's just different things. Drinking was always a big thing in the fishing business, but there wasn't much opioids. And yeah, I've had fellas on this boat OD, and and die. Not on the boat, but on shore. One of them was a real young boy that was family friend. We left to come home for Thanksgiving, and then knuckleheads stopped in Atlantic City, got hold of some drugs, and that boy died. Great kid. It broke my heart. And that really woke me up. Didn't happen on the boat, but it could have. Man, we gotta be prepared. So since then, I've been on like a mission to make sure everybody has that. We all have Narcan now. But there's a big stigma, sure is. I used to look down on it like, you just stop doing that. Well, they can't. I went around saying, hey man, here's a couple things of Narcan, and we ain't putting that on this boat. We don't need that. I don't have drug addicts on my boat. Yeah, but you do, man. You just don't know it. This is my Narcan kits. Got 2 of them. We're kind of trained at it. Lay the fella down on the ground, put this up in his nose, hit the button, shoots him in there, and hopefully brings him back. I've never had one go down where I've had to do this, but I'm sure I can handle it if I have to.
Narcan is a substance that when an individual gets flooded with opioids and the receptors get overwhelmed, and then it creates respiratory failure, essentially because there's too much of an opioid in someone's system. When someone is given Narcan nasal or injection, what happens is it pushes all the opioids out of someone's system for the moment. We learn from families over and over that they're still having trouble getting access to Narcan. It is insane that there's not Narcan everywhere. I walked to the office today and passed 2 COVID testing centers, and yet I can't get my hands on Narcan. Why would anyone argue not to save someone's life? That stigma is so ingrained in people that they would literally be okay with someone dying before saving their lives.
The Narcan has helped us twice already in a year, saved 2 guys this year that I know of. One of our boats here, the Jersey Cape, was fishing in the same area as another boat that had an overdose.
Coast Guard Channel 16, over.
Somebody better get here quick.
Captain, what's your GPS?
Captain Mike Cox on the Jersey Cape took his Narcan over, got close to that boat, tossed it aboard. Tossed 2 of them, and they say it took the second one to get that guy back. But if we hadn't had that, that guy might not have made it home.
You know, after the overdose on the boat, all of them changed their tune a little bit because it became personal. Like for me, my son had overdosed multiple times. I reversed 5 overdoses myself. And one time, you know, I just did rescue breathing until somebody came because I always had Narcan, but I didn't have Narcan that particular time, and that was horrifying. And that stuff is traumatic. And, you know, I think people have this idea, like, so maybe people are in pain when they're overdosing. Like, it's me that was in pain. I had the pain, you know, and it's, you know, that stuff doesn't go away. You know, it's still there.
My kids carry Narcan with them. My 16-year-old was in a health class and they were talking about Narcan and he took it out. And everybody looked at him like, what are you doing with that? And he's like, oh, my dad makes me carry this around just so I can save a life.
Overdoses before Narcan, they died. You're 100 miles away from anything. If they need the helicopter, he's an hour and a half away. You know, he ain't gonna make it. And there's been probably 6 or 8 that I know of over the years that died and they could have saved them. If I use it one time, you know, if I pass it to another boat that don't have it one time, you save one guy. It's worth all of it, you know? I mean, everybody deserves to have a chance of living, so. I've had personal family experiences with it. I had 4 kids and all 4 were addicted. One of them died, my oldest son, He committed suicide. But it was from the drugs and the alcohol, you know. When my son passed away, that was life-changing for all of us. We're in an exclusive club, me and Tanya, that nobody wants to be in. You know, that's why we're kind of trying to be active in this and help these young guys out. Tanya says now they instant help if they want it. You know, get off the boat, the guy's standing right there. Let's go. You want to go to a rehab? Do you want to go to a doctor? Whatever you want, we're going to do it for you, which I think is great.
My hope is that we can get this pilot program going in Cape May County and then hand the program over to other people, you know, in other communities. There's too many people who reach out to me and say, your son sounds like my son. It's amazing to me how similar our stories are. And I don't know that we're heard. You know, and unfortunately, you know, losing a child, I have a little bit stronger voice right now, which is a shame. You know, that's what it takes sometimes. But I'm gonna use that, you know, as much as I can to get to who I need to get to change the treatment system.
It is cost effective to focus on care. It is cost effective to treat people. Because what we see is there's fewer ER visits, there's fewer long-term chronic conditions, there's less lost productivity at work, there's fewer accidents, there's fewer overdoses, there's fewer mental health issues, there's fewer issues for the family who's supporting those individuals. So if we can focus on recovery, we know that everything gets better once someone gets into recovery. The cascading effects and the ripple effects in the economy will be huge.
She's a hard one to burn.
What kind of jelly do y'all want? Grape. Grape?
I don't know. We gotta figure out something.
Where's Amelia at? I don't know.
She's hanging out, taking a break.
Okay.
My dream is obviously treatment on demand. That's the first thing. And whatever that looks like for however many episodes someone needs, helping people in their process. The way I frame it is just like recovery as a whole is a whole compendium of things and what that could look like for the individual. Or how do we find places that help meet the needs of LGBTQIA folks? What about care for folks who are only Spanish speaking? Giving people the option to pull from, like, this feels like what I need. This respects me, this honors me, this looks at me as a whole individual, all my other needs, sees what I can be, sees who I am as a person, and honors that.
Just like any other illness, it's okay to receive compassion, and we should demand it for ourselves and for our kids.
When a family is struggling with addiction, it's not just the individual struggling, it's the entire family. Families, unfortunately, are a casualty. And it's also very isolating because it's so overwhelming. What do I do? What do I not do? But we know that families matter. We know that when families are engaged, they can make a difference.
There are gifts that come to us in different ways. And the blessings that can be found in the deepest sorrow is what has happened for me. I do my work here. I chose to have my desk here. It's a big house, but I wanted to be here so that I could be inspired. The boys' pictures, their portraits are right there. I have my family all around me, and the lake is beautiful and it's inspiring. It feels good to have everyone around me, all the happy things. I have been a parent peer coach for a while now, and I'm dedicated to it because there's nothing better than being able to talk to someone who has walked in your shoes. I so wish I had had someone. None of us are islands, and this is going to be happening to someone else, you know, someone you may know, and we need to be there for each other.
Molly started her journey with methadone about 5 years ago. You know, it took her a couple years to really get stabilized on the medication, but my daughter has not smoked or used illicit IV fentanyl or heroin in 5 years. And I'm so proud of her.
Oh, look at the horsies.
When Molly told us that she was gonna have a baby, of course, we were scared. But we talked about when she was young, you know, and you ask your kids, what do you want to do when you grow up? Molly always wanted to be a mother. What do you want to do, honey? I just want to be a mom. So I have a grandson who's 15 months old. It's my first grandchild. This is just like the greatest thing that has ever happened to me. It's hard to even put into words, seeing her. It just brings me so much joy. She is just so beautiful with her son. And I think she's just as grateful that she survived to be able to be Luca's mother. It's a miracle. I am a better person. I am a better mother. I am a better wife because of what I've learned in my journey with my daughter. Addiction is a life-threatening disorder. I've learned to just be in the moment. This is all we have right here, right now. Tomorrow isn't promised. A lot of people aren't going to make it, but we sure can love them. We sure can put our arms around them. You can reach out and just say, I'm here for you. I will sit with you in your darkness. That's really what's brought us as a family out of such a dark place and into the light.